Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is an NCLEX case study. Without the way, let's get started.
Mr. D, a 19-year-old pre-med student, has been brought to the emergency department by his roommate, who is a medical student and a family friend. Mr. D reports abdominal pain, polyuria, vomiting, and thirst. He appears flushed, and his lips and mucous membranes are dry and cracked. His skin turgor is poor. He has deep, rapid respirations, and there is a fruity odor to his breath. He has type 1 diabetes, and may have skipped a few doses of insulin because of cramming for finals. He is alert and conversant, but is having trouble focusing on the nurse's questions. Mr. D's vital signs and blood glucose are as follows: blood glucose level, 685 mg per deciliter, blood pressure, 100/60 mm of mercury, heart rate, 120 beats per minute, respiratory rate, 32 breaths per minute, temperature, 100.8 degrees Fahrenheit. Question 1. To clarify pertinent data, which questions would the nurse ask Mr. D? Select all that apply. 1. When did your symptoms start? 2. How many times have you vomited? 3. When were you diagnosed with diabetes? 4. Where does your abdomen hurt? 5. Did you take any insulin today? 6. Do you have any allergies? The correct answers are 1. When did your symptoms start? 2. How many times have you vomited? 4. Where does your abdomen hurt? 5. Did you take any insulin today? And 6. Do you have any allergies? Rationale. The onset of symptoms and the amount of fluid loss help to determine acuity. Pain assessment of the abdomen should be performed to obtain a baseline. His pain is probably associated with diabetic ketoacidosis, but infection or trauma also cause pain. If Mr. D had insulin today, this could affect treatment. Information about allergies should be obtained for all patients, regardless of the presenting problem. Knowing when the patient was diagnosed with diabetes does not alter the priority actions at this point. Question 2. The nurse has completed the triage assessment and history taking. Which action is the priority? 1. Page the emergency department's healthcare provider to come to triage. 2. Call the patient's parents for permission to treat. 3. Notify the patient's primary HCP. 4. Take the patient immediately to a treatment room. The correct answer is 4. Take the patient immediately to a treatment room. Rationale. Mr. D should be taken to a treatment room for immediate evaluation and treatment. Paging the emergency department provider to come to the triage area is not necessary unless the patient becomes unresponsive in the triage area. Calling the parents is not necessary because Mr. D is old enough to provide consent for himself. If Mr. D were underage, the treatment would not be delayed if the parents were unavailable in an emergency situation. Calling the primary HCP is usually done by the emergency department's provider after the preliminary workup is completed. Policies for calling the primary HCP vary among institutions. Be familiar with facility policies. Question 3. Based on the patient's history and clinical presentation, the HCP says that the probable medical diagnosis is diabetic ketoacidosis. In DKA, which abnormalities would the healthcare team expect to see and treat? Select all that apply. 1. Ketosis. 2. Metabolic acidosis. 3. Dehydration. 4. Hyperglycemia. 5. Glycosuria. 6. Cardiac dysrhythmias. 7. Hyperosmolarity. The correct answers are 1. Ketosis, 2. Metabolic acidosis, 3. Dehydration, 4. Hyperglycemia, 5. Glycosuria, and 7. Hyperosmolarity. Rationale. Hyperglycemia, ketosis, and metabolic acidosis are hallmark characteristics of diabetic ketoacidosis. Hyperglycemia results in glycosuria. This causes osmotic diuresis and fluid and electrolytes are lost through urination. Hyperosmolality of the blood draws water from the cells, causing cellular dehydration. Lack of insulin causes the body to metabolize fats at a higher rate, and this leads to ketosis. Metabolic acidosis occurs as a result of the acidic byproducts of fat metabolism. Polyuria is expected and urine output is closely monitored, because severe hypovolemia can cause acute renal failure. There is a risk for cardiac dysrhythmias, but they are not expected. Electrolytes must be closely monitored and corrected. Electrolyte imbalances can cause cardiac dysrhythmias. Question 4. Which nursing concept is the priority in planning the initial emergency interventions for Mr. D? 1. Gas exchange. 2. Acid-base balance. 3. Fluid and electrolyte balance. 4. Adherence. The correct answer is 3. Fluid and electrolyte balance. Rationale. Mr. D is severely dehydrated and is at risk for hypovolemic shock and electrolyte imbalance. Although he is demonstrating Kussmaul respirations, this breathing pattern is the body's attempt to compensate for the acidosis. Acid-base imbalance is usually corrected by administering fluids, electrolytes, and insulin. Adherence is relevant but can be addressed after Mr. D's condition is stabilized.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions.
Question 5. Which tasks can be delegated to an experienced assistive personnel? Select all that apply. 1. Measuring and reporting Mr. D's vital signs every 15 minutes. 2. Taking and reporting Mr. D's blood glucose level. 3. Bagging and labeling Mr. D's belonging. 4. Updating the roommate regarding Mr. D's status. 5. Measuring emesis and cleaning the basin as needed. 6. Obtaining an infusion pump from the supply room. The correct answers are 1. Measuring and reporting Mr. D's vital signs every 15 minutes. 2. Taking and reporting Mr. D's blood glucose level. 3. Bagging and labeling Mr. D's belonging. 5. Measuring emesis and cleaning the basin as needed. And 6. Obtaining an infusion pump from the supply room. Rationale. Taking vital signs, bagging up belongings, obtaining equipment, measuring output, and assisting with hygienic needs are within the scope of duties for the AP. Checking the blood glucose level is accomplished with a finger stick. APs, particularly in specialty areas such as the emergency department, will usually receive training to do this task, but this may vary by state and facility. Information should not be released by the AP because of confidentiality issues. Release of information to friends and family varies by facility policies, but typically the nurse would escort the family in to see the patient as soon as possible. Question 6. For the initial emergency care of Mr. D, which collaborative treatment goal is the priority? 1. Correction of hyperglycemia with IV insulin. 2. Correction of acid-base imbalance using IV bicarbonate. 3. Correction of fluid imbalance with IV fluids. 4. Correction of potassium imbalance with IV potassium. The correct answer is 3. Correction of fluid imbalance with IV fluids. Rationale. Fluid replacement is the first priority. Furthermore, the fluid dilutes the glucose levels, which helps to correct osmotic diuresis. The serum potassium level may not reflect the total body potassium. Hypokalemia occurs because of loss of potassium in the urine and transcellular movement of fluid. However, potassium levels are closely monitored and supplements are given accordingly. Insulin is given to slowly lower the blood glucose level, but this occurs after rehydration and evaluation of potassium levels. Bicarbonate is rarely given unless acidosis becomes life-threatening. Acidosis usually resolves with fluids, electrolytes, and insulin. Question 7. In the initial emergency care for Mr. D, which HCP prescriptions would the nurse question? Select all that apply. 1. Start a peripheral IV line with a large bore catheter. 2. Obtain a urine specimen with a small bore straight catheter. 3. Administer regular insulin subcutaneously. 4. Maintain the patient in a semi-Fowler position. 5. Initiate continuous electrocardiographic monitoring. 6. Encourage intake of oral fluids as tolerated. The correct answers are 2. Obtain a urine specimen with a small bore straight catheter, 3. Administer regular insulin subcutaneously, and 6. Encourage intake of oral fluids as tolerated. Rationale. The nurse would question the insertion of a straight catheter to obtain a urine specimen for a patient who is alert and able to use a urinal or commode, because there is currently an emphasis on reducing catheter-associated urinary tract infections. Subcutaneous insulin requires time to absorb. IV insulin is preferred. The patient is likely to be on food and fluid restrictions until the vomiting resolves. In addition, intra-abdominal conditions should be ruled out before allowing oral fluids. At least one peripheral IV is needed for fluid replacement during the acute period. Semi-Fowler position is preferred to reduce the risk for aspiration. ECG monitoring is appropriate for all critical care patients. In this case, electrolyte imbalances increase the risk for dysrhythmias. Question 8. According to evidence-based practice, which IV solution will the HCP prescribe first for the initial fluid replacement? 1. Normal saline. 2. Half-strength saline. 3. 5% dextrose in water and half-strength saline. 4. Normal saline with potassium chloride. The correct answer is 1. Normal saline. Rationale. Normal saline is the first fluid used to correct dehydration in most adults with diabetic ketoacidosis. Half-strength saline can be used for children and adults at risk for volume overload. Potassium supplements are added to correct potassium deficit before starting insulin. Solutions of 5% dextrose are added to the therapy when the blood glucose level approaches 250 mg per deciliter.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions.
Question 9. The HCP instructs the nurse to give 1 liter of IV fluid over the next hour. The available IV pump delivers fluid in milliliter per hour and allows 3 digits for programming the flow rate. Which action would the nurse take? 1. Try to find a pump that will accurately deliver the fluid. 2. Program the pump for 1 liter per hour and start the infusion. 3. Ask the HCP to revise the rate to accommodate the available equipment. 4. Program the pump for 999 ml per hour and start the infusion. The correct answer is 4. Program the IV pump for 999 ml per hour and start the infusion. Rationale. Many pumps only allow 3 digits for programming flow, so the nurse knows to use the available IV pump and program the rate to 999 ml per hour. It would not be possible to change the pump to deliver in liter per hour. The arterial blood gas results for Mr. D are pH 7.25, PaO2 97 mm of mercury, PaCO2 25 mm of mercury, bicarbonate 19 milliequivalents per liter. Question 10. Which physical assessment finding is most likely to accompany these laboratory results? 1. Kussmaul respirations. 2. Dilated pupils. 3. Increased urination. 4. Elevated blood pressure. The correct answer is 1. Kussmaul respirations. Rationale. The ABG results indicate metabolic acidosis. The pH is low. PaCO2 is decreased because the deep and rapid Kussmaul respirations are the body's attempt to lower the pH by blowing off carbon dioxide. Bicarbonate level is the metabolic component of the ABG. In metabolic acidosis, the bicarbonate is low. PaO2 is normal because gas exchange is not impaired in metabolic acidosis. Question 11. Which complication, secondary to the treatment of diabetic ketoacidosis, is most common? 1. Cerebral edema. 2. Pulmonary venous congestion. 3. Hyperkalemia. 4. Hypokalemia. The correct answer is 4. Hypokalemia. Rationale. Hypokalemia and hypoglycemia are the most common complications associated with the treatment of diabetic ketoacidosis. In diabetic ketoacidosis, the initial serum potassium level may be normal or elevated, but this is because of diuresis and fluid shift within the cells. The body could have an overall potassium deficit. Insulin causes intracellular movement of potassium and bicarbonate therapy and can contribute to hypokalemia. Hypokalemia can be avoided by carefully monitoring the potassium and glucose levels and then adding dextrose and potassium to IV fluids as needed. Cerebral edema is seen in children and is related to rapid fluid resuscitation. Pulmonary venous congestion is a potential complication, but this has not been validated by research findings. Question 12. Which action would the nurse take first to follow up on the patient's report of abdominal pain? 1. Assess for paralytic ileus, which is expected with DKA. 2. Assess pain and obtain a prescription for pain medication. 3. Perform assessments for a possible abdominal infection. 4. Wait for pain to resolve after treatment of DKA. The correct answer is 3. Perform assessments for a possible abdominal infection. Rationale. Abdominal pain is a common symptom of diabetic ketoacidosis. However, an infection can also trigger diabetic ketoacidosis. An intra-abdominal infection, such as peritonitis or appendicitis, would also cause abdominal pain. The nurse would continue to assess the abdomen. Worsening pain with tenderness and rigidity and unresolved elevation of temperature would be reported to the HCP. Paralytic ileus is not expected in diabetic ketoacidosis, but is a sign of hypokalemia, which is a common complication of therapy. Administering pain medication would not be the first action. The pain should resolve after treatment if the metabolic disturbance is the cause. However, the nurse would perform ongoing pain assessments.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions.
Question 13. An IV potassium infusion needs to be started. Which information, related specifically to the potassium infusion, is the most important to give to the intensive care unit nurse, who will assume the care of the patient? 1. Mental status and cognition have improved with therapy. 2. Urinary output is 60 ml per hour, and urine is a clear yellow color. 3. Admitting blood pressure was 100/60 mm of mercury. Last blood pressure is 125/76 mm of mercury. 4. There are 2 existing peripheral IV lines, and both flush easily. The correct answer is 2. Urinary output is 60 ml per hour, and urine is a clear yellow color. Rationale. Before potassium is administered, it is important to know that the kidneys are functioning. Potassium should only be administered to patients with good urinary flow, as it is primarily eliminated from the body through the kidneys. If a patient has decreased kidney function or impaired urinary flow, administering potassium can lead to a buildup of potassium in the bloodstream, which can result in life-threatening complications such as cardiac arrhythmias, muscle weakness, and paralysis. The other information is important, but has less relevance to the potassium infusion. Question 14. The nurse overhears the AP talking to someone on the phone. The AP says, yes, Mr. D is doing much better than when he first got here. I will tell him that you called, and I will give him your message. Which action would the nurse take first? 1. Ask the AP about the phone conversation that was just overheard. 2. Remind the AP that release of information is outside her scope of practice. 3. Report the AP to the nurse manager for a patient privacy violation. 4. Give positive feedback for trying to help the patient and the caller. The correct answer is 1. Ask the AP about the phone conversation that was just overheard. Rationale. First, the situation should be assessed to determine if a privacy violation has occurred. Patient information should be released only to facilitate continuity of care, and only to those who are directly involved in the care. If Health Insurance Portability and Accountability Act rules were violated, the incident would be reported to the nurse manager for potential complaints related to the AP's actions, and so that the AP could receive the proper remediation. Giving positive feedback for sincere efforts to assist patients and families is appropriate, but guidelines must be recognized and followed. Question 15. Which tasks can the nurse direct an experienced AP to perform to facilitate Mr. D's transfer to the ICU? Select all that apply. 1. Giving Mr. D's roommate directions to the ICU waiting room. 2. Independently transporting Mr. D to the ICU. 3. Collecting and organizing the chart and laboratory reports. 4. Obtaining a portable oxygen tank and cardiac monitor. 5. Connecting Mr. D's ECG leads to the portable cardiac monitor. 6. Obtaining the last set of vital sign values. The correct answers are 1. Giving Mr. D's roommate directions to the ICU waiting room. 4. Obtaining a portable oxygen tank and cardiac monitor. 5. Connecting Mr. D's ECG leads to the portable cardiac monitor. And 6. Obtaining the last set of vital sign values. Rationale. The AP can direct family and visitors to appropriate waiting areas, obtain equipment, and measure vital signs. A nurse or an HCP should accompany Mr. D to the ICU. The AP can help but should not independently transport patients to the ICU. The unit secretary usually prepares the papers, but the nurse is responsible for ensuring that everything is in order. In specialty areas such as the emergency department, APs may receive additional training to connect patients' cardiac leads to the cardiac monitor. However, the nurse is responsible for ensuring the lead placement and for assessing the cardiac rhythm. Question 16. The nurse is preparing to transfer Mr. D to the ICU and notices the cardiac monitor display. Which ECG pattern is cause for greatest concern? The pattern in picture 1, 2, 3, or 4. The correct answer is 2. Rationale. Option 2 shows ventricular tachycardia, which can be associated with an electrolyte imbalance, such as hypokalemia. This is a significant cause of death in patients with diabetic ketoacidosis. Option 1 shows normal sinus rhythm. Note that 1P wave normally precedes every QRS complex. Option 3 shows atrial fibrillation. Patients with atrial fibrillation should be assessed for decreased cardiac output. Patients may tolerate atrial fibrillation, but this finding should be reported to the HCP because there is an increased risk for emboli. Option 4 shows artifact, which is usually caused by loose leads or patient movement.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 17. In caring for Mr. D, the nurse is vigilant for signs and symptoms of hypokalemia. Early detection and treatment are necessary to prevent complications, such as lethal cardiac arrhythmias. Which signs and symptoms are characteristic of hypokalemia? 1. Fatigue. 2. Cold, clammy skin. 3. Muscle weakness. 4. Hypotension. 5. Weak pulse. 6. Shallow respirations. 7. Paralytic ileus. 8. Nausea and vomiting. 9. Abdominal distension. 10. Irritability. The correct answers are 1. Fatigue, 3. Muscle weakness, 4. Hypotension, 5. Weak pulse, 6. Shallow respirations, 7. Paralytic ileus, 8. Nausea and vomiting, 9. Abdominal distension, and 10. Irritability. Rationale. All of these signs and symptoms are associated with hypokalemia, except cold, clammy skin, which occurs with hypoglycemia or decreased perfusion. Hypokalemia is a low level of potassium in the blood. Potassium plays an important role in nerve conduction and muscle contraction. The most serious complications are cardiac dysrhythmias, with the potential for cardiac arrest. Question 18. Many hospital employees have legitimate reasons to be in and out of the emergency department. In addition, most larger hospitals allow system-wide electronic access to patient records. Furthermore, most patients have family and friends who are concerned about the well-being of their loved one, and they would like to be informed about the condition, treatments, and outcomes. Which people would have access to Mr. D's medical records? Select all that apply. 1. Emergency department's healthcare provider, who is managing the care in the emergency department. 2. ICU nurse who will receive Mr. D upon transfer to the ICU. 3. Nursing student, who wants to write a paper about DKA. 4. Roommate of Mr. D, who is a medical student and a family friend. 5. Labor and delivery nurse, who is Mr. D's girlfriend. 6. Clinical nurse specialist, who is conducting research on insulin compliance for her doctoral degree. 7. Emergency department nurse who is caring for Mr. D in the emergency department. 8. Hospital chaplain, who offers to speak with Mr. D's family if needed. 9. Discharge nurse, who will provide instructions and referrals at discharge. 10. Quality assurance nurse, who is performing documentation audits for all emergency department patients. The correct answers are 1. Emergency department's healthcare provider, who is managing the care in the emergency department. 2. ICU nurse, who will receive Mr. D upon transfer to the ICU. 7. Emergency department nurse, who is caring for Mr. D in the emergency department. 9. Discharge nurse, who will provide instructions and referrals at discharge. And 10. Quality assurance nurse, who is performing documentation audits for all emergency department patients. Rationale. For protection of medical information, access is restricted to staff who are involved in the direct care of the patient. By job description, the quality assurance nurse has access to patient records for the purpose of reviewing the direct care and documentation provided by the nursing staff. Friends and family do not have access to medical records without specific consent of the patient. Students are allowed some access to medical records, but only if they are involved in the direct care of patients. People conducting research may have access to patient records, but this involves a formal process to obtain research approval. Hospital employees, such as the chaplain, social worker, or nutritionist, may have access to some portions of the patient's record, but would not freely access the record unless they became involved in the patient's care.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.